Welcome to Roadmap to Residency, evidence-based application. So in this video, we will be going through some questions about cardiovascular pharmacology. Now we have discussed about the different drugs used in CVS conditions in their particular videos in the cardiology module. You can go and watch that. Now, here we have which of the following best describes the mechanism of action of the calcium channel blockers in the management of arrhythmia such as atrial fibrillation. Now that's why I tell you to read the last line first. Now, since we have read this last line, we do not need to read the rest of the vignette. So the options are inhibition of sympathetic outflow from the central nervous system, blockade of beta adrenergic receptors in the heart, inhibition of sodium channels in cardiac myocytes, blockade of L-type calcium channels in cardiac myocytes, inhibition of potassium efflux from cardiac myocytes. So you all know the answer. That is blockade of L-type calcium channels in cardiac myocytes. So the calcium channel blockers are a class of medications commonly used in the management of various cardiovascular conditions, including hypertension, angina, and certain arrhythmias such as atrial fibrillation. The mechanism of action of calcium channel blockers involves blockade of L-type calcium channels in cardiac myocytes. These voltage-gated calcium channels are responsible for allowing the influx of calcium ions into cardiac myocytes during the plateau phase of the action potential, leading to myocardial contraction. By inhibiting the influx of calcium ions, calcium channel blockers reduce the myocardial contractility and slow the conduction through the AV node, resulting in negative chronotropic and bromotropic effects. In the context of atrial fibrillation, the calcium channel blockers are often used to achieve rate control by slowing the ventricular response to atrial fibrillation. By inhibiting the calcium influx into cardiac myocytes, CCBs prolong the refractory period of the AV node and decreases its conduction velocity, thereby slowing the ventricular response to the rapid and irregular atrial depolarizations characteristic of atrial fibrillation. This allows for better synchronization of atrial and ventricular contractions and improves the cardiac output. Now, these are the different classes of antiarrhythmic drugs. Class 1 are the sodium channel blockers, which are membrane stabilizing agents. Now, Class 1A, they block the sodium channels and they prolong the action potential. Class 1B, they block the sodium channel and they shorten the action potential. Class 1C, they block the sodium channel with no effect on action potential. We have discussed about antiarrhythmic drugs in detail in our cardiology modules. Class 2 is beta blockers. Class 3 is potassium channel blockers, where the main effect is to prolong the action potential. And class 4 is slow type or L type calcium channel blockers. Verapamil and diltiazem bind only to open depolarized voltage-operated calcium channels and hence preventing repolarization until the drug dissociates from the channel. Therefore, they are use-dependent, blocking rapidly beating heart since in a normally paced heart, calcium channels have enough time to repolarize and the drug to dissociate from the channel before the next conduction cycle. So verapamil and diltiazem, they slow the conduction and prolong the effective refractory period in calcium current dependent tissues like AV node. Now, which of the following medication is the most appropriate long-term treatment for preventing recurrent episodes of PSVT in this patient? Again, you do not need to read the rest of the vignette. So the options are amiodarone, digoxin, flecainide, metoprolol, or verapamil. You can pause the video and go through the vignette, but the answer is metoprolol. So the paroxysmal supraventricular tachycardia is a common type of arrhythmia characterized by sudden onset, narrow complex tachycardia originating above the ventricles. It typically presents with palpitations, dizziness, and occasionally syncope or near syncope. The treatment goals for PSVT include terminating acute episodes and preventing recurrence of arrhythmia. The beta blockers such as metoprolol are considered first-line therapy for the long-term management of PSVT. Beta blockers exert their antiarrhythmic effects by blocking the beta adrenergic receptors in the heart, thereby reducing the sympathetic tone and slowing the conduction through the AV node. This results in prolonged AV nodal refractoriness, decreased AV nodal conduction velocity, and the suppression of reentrant pathways that contribute to the initiation and maintenance of PSVT. So, which of the following medication is the most appropriate initial therapy for this patient's heart failure with reduced ejection fraction? A 65-year-old woman with a history of hypertension and type 2 diabetes mellitus presents to her primary care physician with complaints of increasing fatigue, dyspnea and exhaustion, and lower extremity edema over the past month. C reports difficulty climbing stairs and performing routine activities due to shortness of breath. On physical examination, the patient appears fatigued and her blood pressure is around 40 upon 90. Auscultation reveals bilateral crackles in the lung bases and pedal edema is noted on inspection. ECG shows evidence of left ventricular hypertrophy. Transthoracic echocardiography demonstrates reduced left ventricular systolic function with an ejection fraction of 30% and dilated left ventricular chambers. Which of the following medication is the most appropriate initial therapy in this patient? Furosemide, metoprolol, spironolactone, lisinopril, or digoxin? So the answer is lisinopril. So angiotensin-converting enzymes such as lisinopril are first-line pharmacological agents for the treatment of heart failure with reduced ejection fraction. AC inhibitors exert their beneficial effects in heart failure through several mechanisms, including inhibition of renin-angiotensin-aldosterone system, anti-remodeling effects, and improved survival. What is important here is the anti-remodeling effect. So ACIs, they attenuate the adverse cardiac remodeling by inhibiting the deleterious effects of angiotensin 2 on cardiac hypertrophy, fibrosis, and myocyte apoptosis. This helps to preserve left ventricular function and prevent further deterioration of myocardial function over time. Which of the following diuretics is the most appropriate initial therapy for managing the acute decompensated heart failure in this patient? A 70-year-old man with a history of hypertension, heart failure, and chronic kidney disease presents to the emergency department with complaints of worsening dyspnea, unexertion, and bilateral lower extremity edema over the past week. He reports a gradual increase in fatigue and orthopnea, with difficulty lying flat at night due to shortness of breath. On examination, the patient appears pale and diaphoretic. Vital signs reveal a blood pressure of 160 upon 90, heart rate of 110 beats per minute, respiratory rate of 24 breaths per minute, and oxygen saturation of 92% of room air. Jugular venous distension is noted on neck examination, and bilateral crackles are auscultated on lung examination. And electrocardiogram shows evidence of sinus tachycardia. Chest X-ray demonstrates cardiomegaly with bilateral pulmonary congestion. Which of the following diuretics is the most appropriate initial therapy for managing the acute decompensated heart failure in this patient? Furosemide, hydrochlorothiazide, spironolactone, mannitol, or acetazolamide? So furosemide, which is a loop diuretic, is the most important initial therapy for managing acute decompensated heart failure in this patient. Loop diuretics are the mainstay of therapy for ADHF due to their potent diuretic effects and ability to promote natriuresis and diuresis by inhibiting the sodium and chloride reabsorption in the ascending loop of Henle. This leads to increased urinary excretion of sodium chloride in water, resulting in rapid reduction of intravascular volume, pulmonary congestion, and systemic congestion, thereby relieving the symptoms of heart failure. Thank you for watching. Study.